Today I want to talk about knees. What's the proper placement for your knee when you're standing? Generally, we want the knee to be somewhere in the middle of its range of motion. So if my knee is here, its range of motion is all the way back. This is too far back, and too far forward is bent. So the feeling that we want in the knee is that it is just, there's like a slight little bend in it. It's not straight. And if you have hyperextending legs, your knee can actually go backwards from this point. My leg doesn't do that. But what we want it to do is just sit in neutral. So there's back, there's forward, somewhere in neutral. Now when the knee's in neutral, there's a balanced position that you can feel going through the knee where your knee doesn't have to grip. So if I sink too far back, my knees want to grip because they're trying to keep me upright. Or sometimes if you go too far forward, people like to lock their knees back to balance their body in space. So we just want the knee to be neutral. That should also be relative to the pelvis. So when my knee is at neutral, my pelvis should also be at neutral. So neutral is, for most people, a small amount of bend in the back. There's a mild anteversion or anterior tilt in the pelvis, and the belly's relaxed, ideally. And we can watch a line that goes all the way up from the lateral malleolus, the ankle bone, through the middle of the knee, through the middle of the hip, through the shoulder, and ideally through the ear, through the tragus of the ear. So I'm fairly lined up. My head's probably a little bit forward. My pelvis is in a fairly neutral position. So there's a couple common positions for the knee. It's when the knee goes back. When the knee goes back, oftentimes the pelvis dumps forward and there's too much curve in the low back. Just doing that hurts my back a little bit, so I'm gonna stop. And then the opposite position for that is there's too much bend in the knee and the pelvis is rotated backwards. So you can look at your own body. If you have a flat spine here, you might have a posterior rotation of the pelvis. You might find yourself bending your knees more. That's common. Sometimes people have this really complicated thing where they're tucking the pelvis and sending it forward while locking the knees back. That means that we're locking the hips forward and locking the knees back. The other way to do this locking is to lock the knees backwards and lock the hips forward, but there's like this anterior dumping that happens. Your pelvis is like a bowl, and in this case, if the back is too arched forward, the bowl is dumping its contents out. We want that bowl to be somewhat containing the contents, but also we don't want it to be too posterior where the bowl's dumping backwards. Again, a little bit of forward is normal, and you can see my waistline here. That's about how far my hips are forward. So somewhere in there is good. If we look close up at the knee, what we're looking for in the knee is, again, we don't want it to be locked back. Often the kneecap will be lifted. So see, my kneecap is relaxed here. When it's lifted, it's like that. So when the kneecap is lifted, it indicates I'm flexing my quadriceps. So the lifted kneecap all the way back. If you're locked in this position, this is really going to be hard on the knee and on the hips. You might have some psoas tension that's associated with that because those are all hip flexors and they're usually all kind of acting together. Again, if it's too far forward, now you're going to have tension back here. It's going to put your hips in a weird place. So again, we want to be somewhere here, locked back, bad, too far forward, bad, somewhere in the middle. And the feeling that we're looking for is that your knee is like floating. Like I could bob and it has this float. If it's locked back, it doesn't float at all. It's just stuck in place. And then my other joints are floating around the locked knee. If it's too far forward, you're probably bracing in your legs to keep it there. And that's also a lot of work. So we're looking where we can transmit gravity's force directly through the bones of the leg here without engaging too much in the front or too much in the back. And we're going to allow our weight to drop into our heels. The place that your weight drops through the foot is kind of the front of the heel. About right here is the natural place for the plumb line of gravity to flow through your foot without having to engage too much in your leg when you're standing.